Hey guys, Dr. Paul here. Now a lot of people ask me, should you do take-home whitening or should you do in-office whitening? In this video, we'll talk about the difference so you can decide which one's best for you. Now the first most obvious difference is where they're done. In-office whitening, it's actually done in the office at the dentist, and take-home whitening, surprise, surprise, it's done at home. With the in-office whitening, you'll go in, you lie down, they'll put a protective layer over your gums to protect them, and then they'll put the peroxide directly onto your teeth. Now this is typically refreshed every 10 to 15 minutes and you're done within about an hour or so. Now with the take-home whitening, you use some custom-made trays that you actually fill with gel and you put these over the top of your teeth. Now this is typically left in place for either 30 minutes or up to 8 hours depending on the concentration, and you'll notice results within about 1 up to 4 weeks. Now based on these differences, it might seem natural that in-office whitening is going to be for somebody who wants instant results. They might have a wedding coming up on the weekend, or they don't want to have to wait the week or 2 weeks for the results to be achieved with the take-home whitening. However, in saying that, there are some other factors that we have to consider. So first, which one's going to give the best result? Well, actually, they can both give the exact same result and it's the same stability as well. It's just that in-office is going to get you there faster. Now, one thing with the in-office that you have to consider is that let's say that your maximum whitening is 10 shades whiter. In-office whitening might only get you 8 shades, whereas the take-home, because you can literally do it every single day, it might get you those full 10 shades. So if you want maximum benefit, you can achieve that with take-home whitening, but for the in-office whitening, for the best benefit possible, you may actually have to combine that with take-home whitening anyway. So you do your in-office, and then you might have to do a few extra days of take-home whitening too. You have to consider that. Now, the other thing to know with the in-office whitening is the dramatic effect that you will notice as soon as you finish your whitening. It's because your teeth are dehydrated. You're doing like this for 60 minutes and your teeth have had a chance to dry out. That will contribute to, say, 1 or 2 shades lighter of difference. As they rehydrate in the next 24 hours from your saliva, you will notice that they do change a bit of a color. So don't be too surprised when that does happen. A large difference between them is the resulting sensitivity levels. And this stems from the fact that different concentrations of peroxide are being used. With in-office, a higher concentration is being used and it's much more likely for your teeth to be sensitive. Some patients report it as being quite severe. So there are steps that can be done to reduce the chance of this sensitivity with the in-office whitening. But if you are someone with sensitive teeth already, I'd strongly recommend you against doing it because it might not be worth the risk. Now, it must be mentioned that sensitivity can still happen with the take-home whitening, but because it is done in a much more gradual and controlled way, the chance of that happening is much, much less, and I have a video dedicated to the steps to achieve that. Now, one other thing to consider is the cost. Take-home whitening from a dentist is about $250 to $500 Australian dollars, whereas in-office whitening might be $500 to $1,000. So take-home whitening is definitely more cost-effective. On top of that, with take-home whitening, if you still have some of that gel left over, you can use that, say, 3 or 6 months down the track if you want to top it up, as long as you don't lose your whitening trays. So make sure you do keep everything. If you do run out of the gel but you still have your trays, most dentists will actually sell the gel so you can top up again in the future. So for those that are budget conscious, take-home whitening is much better for you. The last thing to consider is that with take-home whitening, you're in control. I've had a lot of patients come in and say, hey, Dr. Paul, I want whiter teeth, but I only want them a little bit whiter. I don't want them unnaturally white. With take-home whitening, you can choose when to stop. So for some of these patients, rather than whitening the week that we normally recommend, they only whitened for 3 days and found that was enough for them. Controlling the result can be done with in-office whitening, but it is a bit more unpredictable. So to summarize, the main benefit of in-office whitening is that you can get almost instant results without having to go through the time and the process of the take-home whitening. And for the patients that want this, it's the perfect procedure. Now, for those that want value for money and they want to be in control of their results, take-home whitening might be better for you. And for those that do have sensitivity, I don't recommend in-office whitening. Instead, do take-home whitening in a slow, controlled manner. And whichever way you do decide to go, I'd strongly recommend that you do consult with a dental professional first to make sure that you are a suitable candidate for teeth whitening. Anyway, guys, thanks so much for watching. I hope you got something out of the video. If you did, please like, share, subscribe. Those things really help me out a lot. And if you have any questions, put them in the comment section. I will get to them eventually. Have a great day and keep on smiling.